Hypercapnia results from dysfunction of the parts of the respiratory system that are responsible for ventilation. Central nervous system disorders such as head trauma or stroke and spinal cord dysfunctions such as cervical spine dislocations or polio result in a decreased drive to breathe. This decreased drive is usually the result of damage to the respiratory center, which is located in the brainstem, or to an inability to communicate with the thoracic muscles via the phrenic nerve. This leads to a decreased respiratory rate, which in turn causes spinal cord dysfunction such as spinal cord injuries, neuromuscular disease such as myasthenia gravis or muscular dystrophy, chest wall dysfunction such as rib fracture or kyphoscoliosis, or changes in the lung that increase the work of breathing such as emphysema or status asthmaticus, result in a decreased ability to respond to the drive to breathe, and thus interfere with the mechanics of breathing. This results in a decreased ability to generate a tidal volume. A decreased respiratory rate and or decreased tidal volume result in a decreased minute ventilation. A decrease in minute ventilation means that the person cannot rid the alveoli of the carbon dioxide that is generated by cellular metabolism, and CO2 builds up in the blood. This increase in the partial pressure of CO2 is called hypercapnia and causes a fall in pH, known as respiratory acidosis. A secondary result of decreased ventilation is hypoxemia, or a decrease in PaO2. These changes cause persons with ventilatory disorders to become somnolent. They disrupt normal electrolyte balances and can lead to cardiac dysrhythmias, coma, and even death.